So I just wanted to do a really quick video because one of the girls that did training for dermal fillers over 2 years ago now sent me a message, and I had a conversation with her, and I thought this is actually quite a valid thing, an important thing to put out there and to communicate to the other injectors, you guys, the students who have trained with me, those that are looking to get into aesthetics, and specifically I want to refer to dermal fillers at the moment. So actually, also for those of you who have dermal fillers done, this is actually a really good video for you guys to watch as well, because it's really good to have knowledge to understand what's going on and why and how to deal with it. So the situation was that the girl that had done the dermal filler training, she's done hundreds of clients by this point. She's pretty confident and comfortable with doing her dermal filler lips, and she just used a normal brand. I don't want to name the brand because it's actually irrelevant in this situation, but it's just a normal brand that it's an FDA approved brand that a vast majority of people work with. Now, the client had contacted her and said 3 months after she had the lips done that there was actually swelling and lumps in the lips. So this is 3 months post the dermal filler had been injected in her lips. The client's now got some lumps appearing and there's some swelling, and she was really nervous and she wasn't sure what to do. So she contacted me and asked what should she do. So I just wanted to give the advice to you guys that I gave to her. So there are multiple things that can affect the filler and reasons why this could happen. So there are multiple variables that we need to look at. Number one, it's the stage that the filler is at when it is actually breaking down in the patient's body. So the filler starts to break down as soon as you inject it in. That's why it's not a permanent treatment. The client has to come back for top up and they get more done and whatnot, because it's not permanent. It breaks down. It's a foreign body, so it breaks itself down and the body removes it. So one is what stage the filler is at when it's breaking down in the lips. Number two, it's to do with the client's immune response to the product when it's breaking down at that point. So one of the big things that's really important to say is that it could be that also, or maybe as well as, or possibly the reason is the client has got an infection somewhere and the immune system is attacking the filler because it thinks that the filler is a foreign body. Well, actually the filler is a foreign body. It's a product, a synthetic product that we have administered into the body. So it's not a part of the body, it's there naturally. So when the body has an infection and its immune system is attacking the virus or infection, it cannot determine that filler is not a foreign body that is dangerous or that doesn't need to be there. It just attacks everything. So it could be that there's an infection somewhere else or something else going on, and the immune system is reacting and breaking down the filler, and that's why we're now having this. So what do we do to deal with it? Well, I think that in order to deal with this, there are a few different kind of avenues that can be gone down. Dissolving the filler could be one. Another one could be a steroid treatment that would obviously be prescribed by the doctor or GP. Another one could be that there is a course of antibiotics needed to be taken. However, which way, there is not a one size fits all to correct this, to put this right. It is down to each specific situation. So it's really important that you either go back to your teacher, go to your prescriber if you're a non-medic, maybe speak to other practitioners and see if you can get some advice and get some support in the situation as to what's the best course of action with the situation. However, I do just want to stipulate, this is incredibly rare to ever happen. It's incredibly rare. I mean, I've never really heard of it in all the years I've been doing it. However, it's not an impossibility. One of the other things that we didn't mention is that possibly it could be that some bacteria had got in to the site at the point of injecting. And this, don't be freaked out, guys, because it's not uncommon. We're making incisions in the skin, so as much as everybody can be sterile and hygienic and as careful as possible, there is always an element of risk that goes with everything. If you are concerned, or if you're in this situation, ask for help and ask for support and reassure the client, because there are solutions to getting it sorted out.